Good evening to everyone present us. Good evening, Doctor. My name is Pranjal Reen, and I am here on behalf of the Vidyalaya for a new episode of Guru Ka Gyan, an initiative by the Vidyalaya alongside with Max Hospital. And for today's episode, we have with us Dr. Vivek Nangia, Principal, Director, and Head Institute of Respiratory Critical Care and Sleep Medicine, Max Hospital. He is an internationally renowned interventional pulmonologist with over 2 decades of rich experience, and today he will enlighten us about the new COVID variant Omicron. So, over to you, sir.
Okay, so what do you want me to do? Should I do a PowerPoint presentation or you want me to just speak about it?
So, whatever's comfortable to you, you have 20 minutes with you. You can walk us through a presentation, you can just do a free talk, whatever's comfortable.
Okay, so let me take you through a presentation. It'll be easier. And with the graphics, I think it'll be more clear for everything.
True. Yeah.
So just give me a moment. It does not allow me to share.
Then,
Share screen. Okay, okay.
what's happening?
Mhm. Okay. Is it visible now?
Not yet. Yeah, it's visible.
Okay, guys. So let me tell you about this Omicron variant, the pandemic that we're currently facing. This is my team of doctors who are like my pillars, with whom I jointly work and look after the COVID patients in our hospital at Max Hospital, Saket. So, sometimes towards the end of December, WHO had warned us that there is a COVID tsunami that is expected very soon. And no soon, I mean, it didn't take much time, and we realized that yes, the tsunami is there on our heads already. We've always known about this coronavirus into the various different variants alpha, beta, gamma, delta. All these variants are dependent on the type of spike proteins that are present on the surface of this virus. So the virus is a globular surface. On its surface, there are different kind of spike proteins which determine the arrangement of these spike proteins, or the structure of these spike proteins actually determines that what is the kind of variant we are dealing with. This was never a human virus. It was always in the animals, zoonotic virus in the bats. From bats, it went to civet, and from civet, it came into the humans. So, if it keeps replicating in a normal phenomena, then there is no problem. Then the sequence, the virus remains the same. Our body is tuned to it and can fight it out without a problem. The problem comes when certain changes start to appear in its genomic structure. If there is a mild change in the genomic structure, again, there is no problem. But if there's a major change where the spikes change completely, then it becomes an altogether new virus for us to fight. And then our immune system is also not tuned to it. Omicron is one such variant which has more than 50 mutations in its genetic makeup, and more than 30 of them are in these spike proteins. These spike proteins are the proteins that the virus uses to latch onto the human cells and then enter into the human body. So, if there are changes in the protein, then it behaves like a new virus. We have no immune mechanism against this virus. As a result, we become more prone, more susceptible to catching this infection. Already, there are three subvariants of this Omicron variant that are existing: BA1, BA2, and BA3. So we have the Omicron and three other subvariants which are existing in the system. Whenever there is a change in the virus genomic structure, it basically makes the virus either more potent, more transmissible, or maybe more able to evade the immune response. So if we look at the transmissibility, well, yes, the as compared to SARS-CoV-2, where the R naught is the reproduction number, which basically means that how many people is one individual patient able to infect. The original virus, the R naught, was 2.5. With Delta variant was around 7. With Omicron, it's as high as 10. That means one patient can infect 10 other patients. And this is what we are seeing, and that is the reason why the number of cases are doubling so fast. The numbers that used to occur in the Delta variant in 6 weeks are now occurring only in 2 weeks. So that is how fast the replication is occurring. One of the main reasons for this is that it is 70 times more potent attached to the airways. Airways include the main windpipe and the right and the left bronchi. So this virus has a huge affinity towards this area and remains here mostly. In a few patients, it goes into the lungs also, but majorly it remains here. As a result, it is when the patients cough, it spreads easily because it results in a milder illness. So people roam around with the illness and spread it to others as well. As compared to if somebody was to have a pneumonia, then it would become a severe illness, and then those patients would be bedbound or hospitalized, or at least they would realize the importance of their illness. Here, people are not realizing that they are unwell or they are sick and spreading it to others as well. And this virus is able to evade our immune system also, making it like a new virus completely. And our immune system is unable to cope up with it. If you look at the figures from Africa as far as transmissibility is concerned, then they had a wave in June, they had a wave in October 20, then they had a wave in August 21, and now they have this wave going on since December 21. If you see, there's a sharp rise in the number of cases between the first three waves. Again, meaning that the doubling time of the number of cases is very, very high. The people getting infected are very, very high in number. But luckily, the silver lining to the cloud is that just how steep it rose, it falls also as steeply. So we are hoping that in 6 weeks' time, this wave should also be coming down, especially now when the vaccination rates are also high. Same has been the trend in the US, where the number of cases are all-time high right now. They haven't experienced as many high cases, as many hospitalizations as are happening now as compared to even in the Delta wave or throughout the pandemic. These days, the number of cases being reported from the US are all-time highest record as compared to ever in this entire pandemic that has been on for the last 1.5, 2 years. And what the major problem that they're facing now is shortage in the hospital staff, the healthcare workers. There's a major shortage that is happening there. Even in UK, if you see their waves, it has never been as high as it is now. They're experiencing the largest number of cases in UK now. They're also experiencing a major healthcare shortage. The worker, doctors, nursing staff, paramedics, they're all falling prey to COVID illness and landing up in their own hospitals. So, of course, this is all a one single global village. If there's something happening in the West, India also will get affected. These are figures of yesterday or day before probably, when India has seen 3 lakh cases in a day, which has been the highest ever in the last 8 months. And majority of them are Omicron variant right now that we are suffering with. The hospitalization is probably 10%, going up till 20% now, especially because initially it was affecting the younger crowd, which were in their 20s and their 30s. Now it is affecting mostly the elders and those who are immunocompromised. So most of them are getting hospitalized. And the severity of illness is also increasing. If we go by the data from South Africa, they had shown in their study that as compared to Delta variant, in the Omicron variant, the percentage of cases requiring hospitalization was significantly lower, requiring ICU admissions, ventilatory support, and death rate was significantly lower with the Omicron variant as compared to Delta variant. So also has been seen in the study from Johns Hopkins University, where they have shown that although the number of cases is high, but the ICU admissions and ward admissions is significantly lesser. This is also because probably we've had a Delta wave in the past, we've had good vaccination rates, so there is what is called a hybrid immunity which has been generated. As a result, we can expect this illness to be relatively milder if we are vaccinated. But the issue is that if the numbers keep rising like this, and if we see that the Omicron cases are 5 times more than the Delta variant, then even if it is half as severe as the Delta variant was, yet the number of admissions would be significantly higher. This is just a rough estimate or rough guess or rough example that I've quoted, that if there are 50,000 cases and we know Omicron is 5 times more transmissible, so the number of cases is 2.5 lakhs, and if the severity of Delta variant required 2% of the patients to get hospitalized, in the Omicron, we expect 1% to be getting hospitalized, which is half. So, yet the number of patients getting hospitalized is significantly higher, which could actually overwhelm our hospital systems. What is also important is that if these numbers continue to rise, then the non COVID patients also start to suffer. And this happens primarily because the non-COVID patients then do not, they hesitate in coming to the hospital, they try to hide their illness, they try to suppress their symptoms and do not take proper treatment and seek medical help. The number of ICU beds occupancy is rising steadily in the with the COVID patients. Healthcare workers in India are also getting affected. This virus, as I said, is able to evade our immune system. Therefore, people who've had a double vaccination, plus if they've had an illness also, then they are the ones who have the best protection against this virus. The common symptoms of this virus are cough, scratchy throat, fatigue, cold, runny nose, body aches, low grade fever, which is usually short lasting, 3 to 5 days. In the Delta variant, we used to experience high grade fever along with all these symptoms, and also loss of smell, loss of taste, and of course, the symptoms would last much longer, sometimes even 7 to 10 days. Here with Omicron, we're seeing that most patients are recovering within 3 to 5 days, if not 7 days. The diagnosis remains the same. The diagnostic kit that is used remains the same. The same RT-PCR that was being done for COVID, for a Delta variant, is also confirming for Omicron variant. Genomic studies to understand whether it is Delta or Omicron are done only in a few referral laboratories, which are the higher centers where they are testing. There is a recently made in India kit which has been approved by the ICMR and is easily available now in the pharmacies also, which can actually tell you whether this is an Omicron variant or a Delta variant in less than half an hour. As far as treatment is concerned, the treatment protocols remain the same. There is no significant change in the treatment or the management of these patients because the Omicron virus has undergone mutations in its spike proteins. And none of the drugs that we have target the spike proteins. They all target the intracellular mechanisms to kill the virus. However, it is very important for me to point out here that if the patient is asymptomatic or mild, there is no specific treatment for it. All they have to do is isolate themselves, take some paracetamol if they have fever, keep themselves well hydrated, take some decongestants if they have cold, some cough suppressants if they have cough, but nothing more than that. They don't require any specific medication. They could check their oxygen levels every day with a simple pulse oximeter, do a 6 minutes walk test every day where they check their oxygen before, during, and after the 6 minutes walk test and see whether there's a drop in oxygen level or not. If there's a drop in oxygen level, then they need to be hospitalized and seek proper health advice. This virus is here to stay. What is important is that even if we get rid of this Omicron, there would be some new variant that would come up again. So we need to continue following our COVID protocols. There's already one new IH variant, which is called the IHU, which has been identified in France, and people are working on it, researching on it to understand how severe or serious this illness can be. So Omicron poses a huge threat to India because of the large number of population that we're dealing with. It's able to evade the vaccines as well as the preformed immunity, and it is yet unclear that what kind of long-term damage this virus can leave us with. Therefore, it is very important to avoid crowded places, avoid meeting rooms, wear your masks at all times. These type of fancy masks have not been shown to be very effective now. So what is recommended is to wear a simple 3-ply surgical mask. Keep your hands clean. Maintain a safe distance from people at all times, especially when you're indoors. The ventilation of the room that you're in should be proper. We should be able to say no to social invitations, parties, gatherings, meetings, travel only if you must, and get yourself vaccinated. Vaccination is very, very important. This is the only tool that we have which is effective against the virus, in addition to the masking and the COVID appropriate behavior. So, with this, I'd like to end and open the house for any questions that you may have.
Thank you so much, sir, for all the information you gave us. It was clearly a lot. A few questions that we received are firstly, many people believe that the Omicron variant is reinfecting people who have had COVID before. So, is that true or not?
Yeah, that is absolutely true. It is not reinfecting only those who've had COVID, but it can reinfect people who've had COVID in the past also. Because this is a new variant, we need a new kind of an immune mechanism towards it. Therefore, people who have been infected in the past are equally susceptible or equally prone to catching it all over again. Except that you would expect it to be a milder illness in those who've had the disease earlier and who've also got themselves vaccinated in the past.
Okay. And you already mentioned that, the fever stays for 5 days, and many people believe that nowadays the talk goes around that if you have fever, if you have body aches, it's supposedly they just take it to be the Omicron variant and they don't even get themselves tested. And after 5 days, when the fever goes down, they assume themselves to be negative and they come out. So, is this a cycle that you suggest people should follow or what?
So, to some extent, I would agree with it, but not to the whole extent. I agree
Mhm.
that if you have symptoms suggestive of cold, cough, uh, you first thing you should do is isolate yourself and treat yourself symptomatically. The symptoms usually disappear in 3 to 5 days' time. That's a very good sign.
Okay.
But two reasons why you should be testing yourself. One, to be sure that this is COVID only and no other illness.
Mhm.
That just in case, God forbid, if anybody requires hospitalization, you should be clear that this is COVID and you go directly into the COVID area.
Mhm.
Otherwise, what happens is that when you come to the hospital and you don't have a
Mhm.
COVID report in your hand, we don't know what to do with such a patient. You know
Yeah.
whether to keep them in the COVID area or the non COVID area. Therefore, a diagnosis is very, very essential.
Yeah. Okay.
Second thing is that once you have developed fever, and whether you're testing yourself or not, you should be isolating yourself for at least 7 days, and it
Okay.
should be without fever for the last 3 days. Not that your fever breaks today and tomorrow you can come out of the isolation. No,
Mhm.
it should be without fever for last 3 days. Only then can you come out of isolation. What has been
Okay.
seen is that the maximum transmission occurs within the first 5 days of illness. 85% of the transmission occurs within the first 5 days. Remaining 15% occurs on the sixth and the seventh day of the illness. After the
Okay.
seventh day, the transmission is very, very negligible. So, what my suggestion to everybody is that you should stay indoors for 7 days. After 7 days, when you come out, you should wear a mask even when you're with the family, so that there is that minimal chance of of transmitting the infection to your family members goes down significantly.
Okay. And the last question we have, sir, is that does the Omicron variant come out in the in a rapid test? Like, it's known that rapid tests are a 50-50 chance. So,
Absolutely, it does. In fact, as I just showed you, there's a new kit that has been developed by the Tata Medical Diagnostics, which is able to differentiate and tell you also whether this is the Omicron variant or the Delta variant.
okay. Great. So I think we can now end this session here. Thank you so much, Dr. Vivek. This was clearly a very informative session, and I'm sure all the people who watched the session have gotten their doubts and everything clear. Thank you so much, sir, for gracing us with your
Thank you for having me
presence.
on your show today.
Thank you.